Welcome back to Sleep Better TV with my guest, Dr. Harvey Reiter, who practices dentistry in Las Cruces, New Mexico. Part of his practice area is the treatment of TMJD, or commonly known as TMJ. Dr. Reiter, it's good to see you again. What is TMJ?
Well, first of all, TMJ refers to the joint. I'll actually point to it on myself. Right here where your upper jaw and your lower jaw, they hinge together. That's the TM joint. And then so TMJ actually covers problems within that joint, and also a lot of the muscles of the face and head, especially the muscles that open and close your jaw. Those muscles get strained, they get inflamed, they get a little spasm, and people will have headaches, they'll have difficulty chewing, like chewing gum. They can't chew gum. Wake up in the morning with headaches. They'll notice their teeth are really wearing down. From a lot of these people severely grind their teeth. And even some people will get dizziness, because there's a relation of that joint to the nerves in the ear, and some people will even get some dizziness called vertigo. But the big thing they notice is pain when they're eating, headaches, sometimes difficulty opening their jaw. Sometimes their jaw will lock open, it locks closed. They'll hear popping and all kinds of noise coming from the joint, and with pain associated with it. So there's a lot of symptoms.
And people having TMJ, I mean, it can be very uncomfortable. What typically causes it?
The cause can come from trauma, external trauma. The person falls, gets hit. Another really common cause is what they call micro trauma. That's when people clench and grind their teeth at night over and over and over again, day after day, year after year, causes severe pressure into that joint, and inflammation and pain, and also with the muscles. Those are the two common ones. Some people get, if they have generalized arthritis, it's going to affect that joint too. But and another cause I've seen, if some people, if let's say they went into the hospital for an operation, or they're put to sleep for some reason, when they're putting all these tubes in their mouth and such, they'll open the jaw up a little bit too wide, strain the muscles, strain the tissues inside the joint, and the patient will have pain there too. Another maybe a little less common cause, if their bites, the bite has to be way off to have a problem in the joint. It used to be thought if the bite's off just a little bit, it's going to cause all kinds of problems. But if their bite is significantly off, that's another source of problems for that joint and the muscles around it.
Dr. Reiter, can you talk about the treatment options for TMJ?
Typically, we'll make some sort of appliance, how would I say it, like a plastic device that the patient would wear over their upper teeth or over their lower teeth. Depending on the condition, there's all kinds of designs of these appliances. Some people, we can just make an appliance to wear at night and give them some exercises to do and things to avoid, and that handles the problem. Some people need to wear an appliance day and night for a while. And then usually the daytime appliance, the patient can be weaned off within a month or two and just go back to the night appliance. And the other thing that we'll do is different forms of physical therapy or electrotherapy with TENS units or lasers or ultrasound. And oftentimes they'll have neck and upper back problems. So with these people, a lot of times it's a little combination treatment where we'll work with a massage therapist or a physical therapist or a chiropractor.
And doctor, finally, is this something that insurance can cover?
Insurance covers it. You have to be very committed to help the patient get the insurance to cover it, because usually dental insurance, for the most part, will cover what they call a night guard or a bite guard, and that's for people that maybe just grind their teeth, but they don't have any other symptoms, no muscular symptoms, no symptoms in the joint. But when it comes to the types of appliances and the physical therapy that you need for treating a TMD or a TMJ patient, then now you're dealing with medical insurance. So medical insurance will cover it.
All right, doctor, thank you. My guest, Dr. Harvey Reiter, who practices dentistry in Las Cruces, New Mexico. I'm Scott Drake. Thanks for watching Sleep Better TV.